We've had our program for over 25 years. So it's been around, health law as a field. I mean, compared to contracts and criminal law and property law, certainly it's a new area. But those of us who've been working in it realize that it's been 25, 30 years that law schools have offered courses in it, that people have been practicing health law. And I think what's unique about our program, or why it was even established here, is partly our campus, because we have a health sciences campus that's with medicine and nursing and pharmacy and dentistry and social work. And so there's a nice ability to collaborate with the other faculty from other schools. There's the hospital here, and make those connections. We're also, our location in Baltimore is very, I think, strong for health law. We're close to Washington, D.C., and the federal agencies that regulate healthcare, particularly the Centers for Medicare and Medicaid Services, is right here in Baltimore. So that's also another strength of our program being here. But health law is also a very much of a state area of practice, and so Maryland, in Maryland we have access to the Department of Health and Mental Hygiene with offices in Baltimore, and also we work with the state legislature on various bills regarding healthcare and health law. So that makes it a great place to be, and that also creates opportunities for our students in our clinics and externships. We have lots of externship opportunities at the federal agencies and state agencies, as well as hospitals in the area. Health law is a very broad area. So in terms of courses, there's the business side of health law. We have a course on the business of health care. We have a course on fraud and abuse. We have courses on Medicare and Medicaid and the financing of health care. On hospital law, we've taught courses on nursing home law and long-term care. We also have a strong curriculum in public health law, offering several courses in that, as well as a clinic in public health law. We have other clinics in drug policy and public health, and HIV and AIDS law. We also have a very strong bioethics component to our curriculum. Health law teachers, I think, are very interested in the Affordable Care Act and teaching about that in law schools. Our students who are going out and looking for jobs in the area are, I think, well prepared by the program that we have and the curriculum that we have, because we are teaching them about the different aspects of the Affordable Care Act. And we have a number of our recent grads who are working at CMS or at the federal level in DC, looking at implementation of the Affordable Care Act, as well as at the state level, as each state has to make decisions about how it's going to implement the new law with their healthcare exchanges and whether or not they're going to expand their Medicaid program. So I should also mention that we, in addition to state, local, and national focus, we also have some international work that we do. That we have students that do externships at UNAIDS in Geneva, and have also been placed at the World Health Organization's Office of Human Rights. And most recently, we've sent a group of students from the campus, including law students, to Malawi. And we have been working with the law school there, Chancellor College of Law, to establish some kind of collaboration with their HIV/AIDS clinic and our HIV/AIDS clinic. It's very interesting to see how another country, a less developed country with a very significant HIV/AIDS problem, is dealing with this in terms of the laws that they're passing and comparing them to what we've done here in the United States. And I think it's very educational for us to see what they're trying to deal with and learn some things from them, as well as perhaps they're learning from our experience here with our laws. Recently, I was part of a group of faculty from the School of Medicine and Pharmacy that received a grant from NIH under the Ethical, Legal, and Social Issues program of the Human Microbiome Project. And that was a fascinating and a very exciting collaboration among the different schools to do that kind of research. We were looking at the regulation of probiotics, and we really benefited from the expertise of the scientists and the pharmacy school faculty who have expertise in the development of new drugs and the regulation of foods and drugs and dietary supplements. Also, I teach a class where I have students from the schools of medicine and nursing and law and pharmacy and other schools on the campus. And that mix of the different professional schools is also just a very rich learning environment where they are able to discuss kind of bioethical issues, legal issues, policy issues in healthcare that make for a very exciting class. We have had a number of our law students take advantage of the interprofessional education opportunities on campus, not only the Interprofessional Education Day, but the Interprofessional Education Management Competition. And just the student groups, the Student Health Law Organization has collaborated at times with students from the medical school to bring in speakers and learn about, most recently, the Affordable Care Act and other things going on in our healthcare system. You know, health law really evolves as the healthcare system and medicine evolve, and where there are new areas. So, for example, I recently did the project on the Human Microbiome Project. That is a new initiative by NIH. We are sponsoring a roundtable this spring on law, pain, and neuroscience. So it's looking at how the Social Security Disability Administration is determining whether someone should get disability benefits because of pain, and what are we learning from neuroscience, from things like functional MRIs. Do they tell us whether someone has pain? Can we rely on that? Can the courts rely on what we're learning from neuroscience to determine whether to pay someone damages in pain and suffering? So it's interesting. I think certainly the Affordable Care Act is kind of cutting edge because that's still being implemented, and we're going to be learning a lot about the healthcare system. In Maryland, the hospitals are undergoing a new reimbursement system through the rate setting commission in Maryland, and that will bring changes to our healthcare system that may require lawyers. It will require lawyers to be familiar with that and to look at the impact of that on healthcare institutions and patient care.